Hi, I'm Amy Morgan, Vice President of Consulting Strategy at Spear Practice Solutions, and I am so excited to share with you some of the keys to making your scheduling as effective as possible. Now, in the original scheduling series, we learned how to use the foundational tools to create perfect day templates that produce productivity, profitability, balance, and an ideal culture for best service and results. But what can make a perfect day less than perfect? The dreaded no-shows and cancellations. My running joke is it takes a significant treatment block getting a cold for the practice to get pneumonia. Cancellations are not just bad for business, it's bad for patients as well. Breaking an appointment has a twofold effect on overall health and well-being. So when a patient is a no-show or cancels their appointment last minute, not only do they not get the treatment that they needed, but there's also another person who could have had that appointment time and doesn't get the care they needed. Therefore, it is vital the team understands the underlying causes for cancellations, as well as having the tools to address and resolve these issues. In this series, The Making of an Unbreakable Appointment, we're going to dive deep into the underlying causes of unwarranted cancellations, how to prevent last-minute cancellations, and how to communicate to patients who want to change their appointments. Will there always be last-minute changes to the schedule? Yeah, but with these tools, we can reduce cancellations to less than 5% for both doctor and hygiene. And can we do that? The answer is a resounding yes. In any dental practice, there are legitimate reasons to cancel an appointment. This can't be avoided. Illness, work, childcare demands, they're all real blocks that can prevent a patient from fulfilling their commitment, particularly in hygiene, where pre-appointments occur up to 6 months before the day. To put it bluntly, stuff happens. Handling these real blockers with empathy while quickly finding a new appointment time that works with the patient's schedule is essential. In this series, we're going to focus on the fixable potential cancellations, the ones that can be accountable to their original appointment with just a little inspiration. Let's start by looking at the cold, hard, brutal truth about less than legit reasons for no-shows and cancellations. My friends, it's all about value and control. So why do people no-show or cancel or arrive late? One, they do not feel heard. Therefore, they take back control by passively aggressively choosing not to comply. 2, they do not understand why they need the treatment. They've not accepted that they have a problem, so they see no need for the solution. Therefore, they see no reason to follow through. 3, the basic underlying reason is they do not value their dental or hygiene appointment. They perceive the dental appointment as not as valuable to them as other options before them. Therefore, they choose other ways to spend their time and their money. And number 4, they've no-showed or canceled before without any consequences. So they take control and call the shots that work best for them. And finally, number 5, the perceived pain of showing up for the appointment is more substantial than the physical pain that is prompting the dental care. The perceived pain can be time, money, benefits, obstacles, fear, whatever the perception. If it's more real than the benefits of receiving care, that appointment's probably going to get canceled. So it is painfully obvious. Patient experience, treatment planning, and case acceptance are significant factors in determining patient value and commitment. Therefore, trying to address cancellations with a simple question like, should we impose a cancellation fee, is comparable to trying to mend the Titanic with duct tape. There are 3 specific stages in creating a culture that supports and promotes an unbreakable appointment. Stage 1, prevention, where you create a practice environment where individuals value and commit to their optimal treatment plan. When and how we get true agreement and commitment on a patient's next steps and making that appointment. Stage 2, connection. Respond to patients who cancel or arrive late to change their behavior for the present and future while building loyalty to the practice. When and how we reinforce value and commitment, and how do we address a cancellation successfully? Stage 3, intervention. Clarify the patient's and practice's commitment to one another and create an agreement to continue or sever the relationship. When and how we address patients who no-show and cancel consistently over an extended period of time. As you begin to address this as a team, you have to start with an assessment of your strengths and opportunities. The goal will be to recognize and acknowledge and reinforce what is already working while analyzing and prioritizing areas of growth and improvement in all 3 stages. The following are some of the questions we use in our deep dive assessment and practice solutions that can be discussed as a team to analyze the strengths and opportunities in all 3 stages. Prevention. When presenting treatment, 1, do we listen and clarify that we heard what patients are saying so they co-discover the benefit and value of the treatment solution and we root out any obstacles? Do we ask questions to verify that? If the patient doesn't own their problem and want a solution, there is a strong chance the value and commitment to their next appointment will be low or non-existent. Asking questions, active listening to their responses, and building in customized benefits increases commitment and follow-through. 2, if needed, do we provide supportive financing through financial arrangement strategies? And are our payment arrangements separate from the upcoming appointments? The number 1 objection in accepting and following through on treatment is centered on finance and benefit obstacles. Providing clear financial options increases case acceptance and case completions. If you're setting up internal financial arrangements, it is advisable not to ask the patient to bring their next payment to their next appointment. If that appointment day arrives and they don't have their money on their credit card, they will cancel that appointment. In today's world of online payment dates can easily be separated from appointments. This alone will decrease your cancellations. And 3, do we get agreement on what needs to be done, why it needs to be done, and by when? And do we use language that confirms the appointment the moment it is agreed to? Words like confirmation calls or reminder texts leave a great big back door for a patient to walk through and cancel. The belief needs to be that that appointment is confirmed the second it is made. So instead of a confirmation call or email or text, change the language to courtesy call or email, designed to check in and make sure there are no last-minute questions or things the doctor or hygienist needs to know. Connection. When following up or handling a current cancellation, 1, when a patient does call to cancel, do we listen with empathy to the reason for the cancellation and acknowledge that the patient was heard? Many patients are nervous about canceling. That's why they leave middle-of-the-night messages on the phone system. If a live call is conducted with care, empathy, and stresses concern regarding their oral health and well-being, it reinforces the relationship and future commitment. 2, do we revisit the value of the existing appointment in meeting what they said they wanted? One of my favorite scripts we use in Practice Solutions is, "Doctor indicated in your chart that this was essential treatment. Is there any way possible I can help you keep this vital appointment?" Rather than rolling over and answering a cancellation saying, "Okay, when can you come in?" we are once again reinforcing value. 3, do we make it difficult to receive another appointment quickly? The easier it is to reappoint, the more likely the patient will learn a cancellation has little to no consequence. This can be as easy as indicating there is no availability for some time, but offering a quick call list if something should open up. And intervention when handling a repeat offender. 1, Do we have internal guidelines in place that highlight consequences for that ongoing behavior? Clearly stated black and white guidelines on whether there will be a cancellation fee the first time or how many times a patient cancels before they are only put on a quick call list or invited to another practice that fits their vision and needs helps the team to set effective expectations. When asking these questions, look for the opportunities to change, grow, and improve. Choose your priority improvements wisely. Action plan improvements in no more than one area at a time, and then set clear measurement benchmarks for success. In our next lesson, we're going to highlight the two most important tools in prevention: patient debriefs and baton passes. When a team masters these communication skills, it truly sets up an unbreakable appointment. The following lesson is then going to lean in on the specifics of what to do when the cancellation does occur. Now, is any of this easy? No way. It takes time to build a culture that inspires patients to embrace the unbreakable appointment. With patience and persistence, you and your team can get control of no-shows and cancellations. I promise.